Okay. Good afternoon, everyone. This is the 17th of July, 2024, and this is a support call for emergency preparedness for hospice and palliative care and home health providers across Louisiana and Mississippi. We welcome you. If you've never been here before, welcome. If you have, please feel free to stop me at any time if you have questions, either putting them in the chat box or unmuting yourself and asking the question directly to one of today's speakers. We will be focused in on today on regions 2 and 6. Region 2 is Metro Baton Rouge. Region 6 is Metro Alexandria, Central Louisiana. And we are about 18% through this hurricane season, so we have a long way to go. I want to remind everyone, if you haven't been with us before, that the prediction was that we were going to see 23 named storms this hurricane season, 11 which would be hurricanes and 5 which would be major. This is the Louisiana. The probability that Louisiana will see some tropical disturbance this season, with a 23% chance that would be a major hurricane. Mississippi has a 43% chance probability of seeing some tropical disturbance this year, 13 of which would be major hurricane. If you would like to see the University of Colorado's prediction, then we have recordings and everything that you see underlined in today's sessions or hyperlink to those particular videos. This is our calendar. Just want to remind everyone that next week, I have a hospice conference here in New Orleans that I'll be really involved with. I will be online at 1 o'clock, but it's going to be a rather quick just check in. We don't have any specific program planned, but we just want to make sure that we are maintaining our vigilance during hurricane season. So we will be meeting just to make sure, hopefully there's nothing to be studied during that time. But you can find all of these recordings, the hyperlinks, at this location, either in these slides or on our website under emergency preparedness. These are the questions we ask providers who are taking care of patients in their homes week after week to make sure that you've submitted your plans to your emergency managers, that you have met with your emergency managers, not only in the parish or the county in which your office is located, but in all of the parishes or counties in which your service area includes. Are you using the at-risk registry? It's a great way, a great tool for keeping emergency managers alert as to who your most vulnerable patients are. We'll get to that later. We send out a weekly reminder. If you're not receiving that reminder, please drop me a line and I'll be more than happy to include you in that list. And of course, do you have plans for either transferring care of your patients to another hospice in the event of some sort of evacuation order called for coastal regions of either states? It's imperative that you make sure that there's a continuity of care for your patients and that care is being provided either by yourself or someone you've contracted with in another part of the state to continue that care. I want to just remind everyone, Hurricane Ida came in during a holiday weekend, and it's real important that when you're planning, you're not just planning for Monday through Friday between the hours of 8 and 5. Have you done a tabletop with your staff yet? If you haven't, these are excellent recordings of how to do a tabletop, and these are the questions to be addressed in your tabletop to make sure that everyone on your team is ready in the event that there is some sort of tropical disturbance or some sort of disruption to our normal plans for care for all of the patients in our region. Today, we are going to be focused in on two specific regions. That's regions 2 and 6. Louisiana is divided into 9 regions, as you can see here, but this is the two regions that we will be working with. If you are in regions 2 or 6, these are your contact folks. These are the folks that you need to make sure that you are familiar with in the event of some sort of emergency situation. Specifically, if you're home health or hospice in regions 2 and 6, these are your contacts. Allison Hughes and Connie DeLeo in region 2, and in region 6, Mary Tarver. And these are their contact emails. Get in touch with them. Let them know who you are and make plans to meet with them. In an emergency, relationships are key. And folks that can recognize one another, those are the folks that will benefit most from emergency responses. Let's put it like that. If you're in region 2, if you're a provider in region 2, this is a great sheet for you to hand out to your patients and to your staff members in order for them to be able to download apps and alert systems for the various parishes that make up region 2. Again, you want to download your specific parish alert system, but it's a good practice to include all of the alert systems in your service area. A service area for hospice and palliative and hospice and home health agencies is a 50-mile radius that encompasses a number of parishes in Louisiana as well as in Mississippi. Are you using the at-risk registry, and are you using it properly? The at-risk registry is required in Louisiana for home health and hospices. It's recommended in Mississippi. It connects you, it fulfills the COPs for your agency, the Medicare conditions of participation in terms of emergency preparedness, where you are required to make sure that emergency managers in your service area know about those patients who would have most difficulty if an evacuation order were called. It keeps them aware. The registry keeps the emergency managers aware of who those patients and where those patients are. It's not for nursing home patients. Nursing homes follow a different care plan, but it is for patients who are living in their own residence. I just want to remind you, currently we have about 76 patients in the registry who are either missing a parish or county assignment, and we have about 70 that are missing a zip code. These are both important data points that have to be applied to the patients, especially the parish or the county assignment. Otherwise, the patient's information is not going to go anywhere. Um, this is not for every patient on your registry. The at-risk registry is for patients who are living alone without a caregiver and unable to evacuate themselves, or they have a caregiver, but the caregiver is either mentally or physically not capable of carrying through on an evacuation order, or the family patient doesn't have the means to evacuate. Evacuations can be rather costly. So if your assessment is that the family cannot afford this, they can go into the registry. And finally, the last category are those stubborn patients refusing to evacuate. However, regardless of their reason for putting them into the registry, every patient must sign. Every patient going into the registry must give their consent. And there's a consent form as well as an evaluation form that's available to you to use in that assessment. Each week, we send out a reminder to all of our users of the at-risk registry, reminding them to update their registry list. Using the registry does require that agencies do a weekly update. We suggest that that update take place on Thursday because the algorithm in the software allows for a 7 days of coverage at a time. Once you do the update, that patient's good for 7 days. We send out all of our reports to emergency managers on Friday morning at 7 a.m. So the update has to be done before 7 a.m. on Friday in order for your patients to make that week's list. Each week we send out a fresh list to emergency managers. And this is what emergency managers across Louisiana and Mississippi use to understand the patient population for their particular parish or county. Those outside of hospitals, those who are living in their homes and would need extra assistance with evacuation. Last week, we sent out over 1,000 reminders, and you can see as we get closer to hurricane season, the number of folks who are opening those reminders or is increasing. But we still have about 896 that were unopened, and that may be because those reminders are ending up in your spam or your junk folder. Please look, and if that's the case, give permission to our email to get through whatever firewalls your agency may have. Last week, we started as we get closer and closer to hurricane season. This becomes more and more critical because we have 443 patients in the registry right now, 440 hospice patients in the registry right now who have not been updated, who were not updated last week, and in some cases haven't been updated in several weeks. These are the hospices that have those 443 patients. I need you to get in there and fix that. Or if you see one of your branches listed, but it's not you, please call that branch and remind them that they need to start doing the update in the at-risk registry. So about 25% of our patients or hospice patients are deceased within 7 days of being enrolled. Half of our patients are deceased within 30 days. Patients leave home health on a regular basis. There are periods. So it's important that we're sending a clean and fresh and updated list to our emergency managers every week. This is the hospice list. We have an additional 239 home health patients in the registry, and these are the home health agencies that make up those 239 patients. I need you to get in there and fix this. We need to reduce that number as low as possible in terms of patients who are not being updated. We don't know why they're in the system. They may have died, they may have left service, or the agency may just be forgetting to do the weekly update. I heard recently that an agency said we do the update once a month. That's not going to work. That means that your emergency managers are seeing your patients' names only one time each month. They are planning on a weekly basis, especially as we get toward the peak of hurricane season. They are planning on a continuous basis. And if your patients are sometimes on the list and sometimes not on the list, they're not being included in those overall plans. So please make every effort to start doing the weekly update. If you have issues with your agency doing that, please call me. Let's discuss that so that we can be responsible in terms of getting this information where it needs to be. In terms of, we're going to be talking about regions 2 and 6 today. And in region 2 right now, as of this morning, we have 74 patients who are identified as needing assistance, with another 131 that it says they don't need assistance. We don't know why they're in the system. These are the agencies that have those 131 patients that we don't know about. These are the agencies that need to clean up their at-risk registry, and they need to do the update on a weekly basis. In Region 6, we have 192 patients that would need assistance if there was an evacuation order called for today. And there's another 34 patients that were not updated last week or subsequent weeks before it. And again, these are the agencies in Region 6 that are responsible for those 34 patients. If you're having issues with doing the update, if you don't understand how to do the update, or if you think you're doing it correctly and your name's on this list, then obviously something's not happening in terms of your understanding of the way the software is working. So we need to address that. Please give me a call. You can reach me by phone or by email, and I'll be more than happy to book some time with you to make sure that your agency is doing the updates properly. So, having said that, I know Allison Hughes is with us today. She's with Region 2 in Metro Baton Rouge. Good afternoon, Allison. And I can either do your slides from here, or I can stop sharing and you can take over, whichever you prefer.
Since you have them already organized in your
They're
presentation, I'll
loaded.
be happy to just follow along with you.
Great.
Yes, sir.
Okay, very good.
All right. Good afternoon, everybody. I think most of you on this call know who I am, but for those that are new or have not met, my name is Allison. I'm the administrative designated regional coordinator for healthcare for Region 2. And our area includes East and West Baton Rouge, East and West Feliciana, Ascension, Iberville, and Point Capee parishes. And so today, our presentation will actually start with just a few kind of overview slides, and then I'll hand it off to our Region 2 Public Health Emergency Response Coordinator, Reagan. So next slide, Jamie.
Just a second. Thank you.
There we go. All right, I have a couple of slides here. This is the contact information for myself, as well as a couple of our hospital designated regional coordinators. So they are specific to hospitals, but they are pretty well able to assist just as well as I am. So that's our contact information there. And on the next slide, I've got some more contact information for our other partners on our team here in Region 2. The first one being Reagan. You'll hear from her shortly. And then we have a couple of EMS designated regional coordinators who help us on an ongoing basis, but in particular when we're having to move patients due to a disaster. So their contacts are listed there, Adam and Desiree. Next slide. The next thing I have listed here for you is just a couple of meeting dates that we have coming up. You are always welcome to reach out if you'd like to join one of our coalition meetings. We'd love to have you. We have a couple more left this year for 2024. We moved to an every other month schedule pattern, and so we had our coalition meeting today. But you do still have a couple of other opportunities this year to meet with us. We'll be meeting in September and November. I've got the dates listed there. We usually meet at the East Baton Rouge Parish Emergency Operations Center. I have the address listed there. It's on Harding Boulevard in Baton Rouge over near the Baton Rouge Airport. But anytime you are welcome to reach out to me, outside of those meeting dates, I'll be happy to speak with you really on any day. Next slide. There we go. Okay. From here, I'm going to hand it over to Reagan. I appreciate you all being on the call today and the opportunity to speak with you. So Reagan, I'll turn it over to you.
Thanks, Allison. Hello, I'm Reagan Hinchcliffe. I'm the Office of Public Health Emergency Response Coordinator for Region 2. And so I'm just going to go over what we do for our medical needs shelter here in Region 2. It might be a little different than Region 6 because they have the mega shelter. So for us in Region 2, there's no guarantee that we will open our shelter. That kind of depends on where the storm is headed, what part of the coast it's going to impact, and also which area of the coastal areas that are going to be evacuating. We have our medical needs shelter at Louisiana State University. We have the option to have it at either the Assembly Center or the Field House. It's just up to LSU what we use to open for our medical needs shelter. We also have the option to have a federal medical station there, which is basically the same thing as our medical needs shelter, only it's manned and supplied through the federal government. And then we also recently signed an MOA with Southern University to have another federal medical station on their campus if need be. So that would be if a lot of people needed to be evacuated. Next slide, please. So this is just a picture of what our medical needs shelter looked like when we opened for Ida. That is the field house at LSU, and you can see the cots and hospital beds. It's very open. Not a lot of privacy, so that's definitely something to think about if you're needing to evacuate to a shelter. Okay, next slide.
And something that we want you to talk to your patients about in terms of them relying upon being evacuated to a shelter.
Right. It's really a shelter of last resort. I mean, it is not something, especially if you're on hospice or palliative care, you're not going to get rest in this place. It's not I mean, they are, medical grade cots and things, but it's definitely not a place that you want to go if you are in that situation.
Right.
So
Right.
having a personal plan is really something that you need to focus on with your patients so that they know what they're going to do if they do need to evacuate. Next slide. So, like I said, individual plans are best because the shelter is definitely a shelter of last resort because privacy is limited. But if they are going to come to our shelter, they need to bring a caregiver with them. Also, if they have service animals, those are permitted, but they would also need to bring food and supplies for that. And then but like I said, again, there's no privacy and it's not a hospital. So having, we're not going to have access to the palliative care meds and that sort of thing unless you bring all of that with you. Next slide.
Question, in terms of recent experience with the shelter how long were they kept open? How long did they stay? How long were people living there after hurricanes?
So for my only experience was opening the shelter for Hurricane Ida. I've only been with the state for about 4 years now. So we opened our shelter like a few days after the storm passed through, and we were open for 17 days. Now,
That's a long time to be away
right,
from
but that storm, we opened medical needs shelters in every region but region 9 because we had a larger population because of the nursing home
right.
thing that happened. So that situation was a little bit different. Now I know Patty, I'm pretty sure she's on the call. She'll give you a little bit of a different story for region 6 because they do have the mega shelter there. Now, that being said, yes, we were open for 17 days, but we didn't ever have one person that stayed there for the whole 17 days. Upon admission, discharge planning begins. We don't want anyone in the shelter for longer than necessary.
And when folks come to the shelter, they need to have a caregiver with them, correct?
I mean, it is not mandatory. We're never going to turn somebody away if they don't have a caregiver, but it is helpful. Because like I said, this is a sheltering scenario. It's not a hospital. It's not, the nurse to patient ratio is a lot larger than you would see. So it's not, I mean, we have staff that we can help with the care, but having a caregiver that knows for sure all the needs of that sheltery is definitely something that's important.
One thing I want to remind providers is that if you have patients that end up in the shelter, you are still responsible for going and visiting and providing all of the services that you are required to provide to them while they're in that shelter. So
Right.
that's something for agencies to also think about and to take into consideration in their planning. If if the shelter is in Baton Rouge on LSU or Southern's campus.
Right, correct. All right, next slide, please. So again, having the orders, like if a patient does come, having the physician's orders so that we would know, what kind of treatments, medications, any of that sort of stuff. Bring your medication with you, labeled in a container that we can easily identify as yours, clothing, eyeglasses, toiletries, any kind of diapers, glucometers, or ostomy supplies. Again, we're not a hospital, we're a shelter, so we will have a limited amount of that kind of stuff that we can give to our shelteries, but we don't have a huge amount. So coming prepared with that ahead of time will be very helpful for us in the shelter. Next slide. Again, tube feeding supplies, oxygen and oxygen concentrators, anything medical that you can think of, and then also emergency contact information. It's really important too. Like if you think about somebody coming into a shelter, they're going to get admitted, and then we're going to start working on a discharge plan, and we want to know, okay, so maybe this person can't go back to their house because of the storm damage or no electricity, but maybe we can get them into a skilled nursing facility or a nursing home for the time being for them to wait out when it's safe to come home. But we need to be able to contact somebody, whether it's a friend or a family member, to let them know where we move that person to. Okay, some additional tips just in general for hurricane preparedness. Make sure you fill your car's tank up ahead of time. Make sure your cell phone is charged. If you're gonna have a generator at your house, practice generator safety. Remember, not more than 25 feet from the house. If your OEP or your emergency preparedness designee person for your parish says to evacuate, evacuate. And then if you do evacuate, it's a really good idea to leave a porch light on so that when the power is restored, we can tell that your house has power. One of the things that they will never allow, especially somebody that's electricity dependent for oxygen or anything else, they're not going to let you go back to your house if you don't have electricity. So that's one really easy way for the emergency management team in the parish to know if you have electricity, is that light on. And that's all I think I have.
Well, thank you. Let me ask you one question. When agencies that are along the coastal regions of Louisiana, if there is an evacuation order called, how will those patients, if you are open, how will those patients get admitted into the medical needs shelter? Who makes that decision?
So two ways it can happen, especially here in the Baton Rouge area, is especially if it's like region 3, which is the Thibodeau area,
Right.
and the New Orleans area. If they're going to be affected, that's going to be a lot of people needing to evacuate.
Right.
And so, we'll put people on buses and they'll come through. At LSU campus, we have what we call bus triage. So we'll have like a quick snap medical team jump on the bus and say, hey, how are y'all doing? Do a quick assessment. And if they're good, they can stay on the bus and they'll go on to the mega shelter or other shelters that might be opening. If they are not okay and need to either go to a hospital or a medical needs shelter right away, they'll get taken off the bus and either brought to our medical shelter or federal medical station if one of those were open, or to a hospital if they have decompensated quickly on that bus ride. Because remember, like when they are doing that evacuation from that can be hours and hours and hours on the interstate, even if it's really only a 2-hour drive normally. So that's one way. The other way is when we know there's a storm coming, the now Surgeon General will tell us to activate our triage lines, and each region has a triage line, a 1-800 number and a local number that you can call, and we have nurses that man that line 24/7. And so if you feel like you might need to come to a medical needs shelter, we go through a triage process. And if they are meet the criteria, then we can admit them to the shelter. And then once they're in the shelter, they get triaged once again.
Thank, thank you, Reagan. I appreciate your presentation. Before we go on to Region 6, does anyone on today's call have a question for the folks at either Allison or Reagan in Region 2, which is Metro Baton Rouge? And the other question is, anyone from regions 1 or 3, your patients may potentially end up in region 2 at the Pete Center, Pete Maravich Center, or on campus at LSU or Southern. Do you have any questions to ask for Reagan or Allison? I don't see any. Well, see, there's something in the chat box here. Is the caregiver mandatory?
I think we did cover that. We're never going to turn someone away from the medical needs shelter if they fit and meet the criteria, if they don't have a caregiver. But for these folks, like on hospice, palliative care, home health, having someone there that knows their routine and all of that is going to be so much better for their comfort level.
Right. And I remember after the Hurricane Ike, I was in the shelter here in New Orleans, and we had several hospice patients that came without caregivers, but the hospice provided a sitter to go and sit with those patients because there were several from the same hospice. And so there was a sitter that was taking care of those patients. Because as you said, you're there to offer shelter. You're not there to take care of patients, especially patients at that level that need that level of care. Thank you, Reagan. Thank you, Allison.
You're welcome.
We're going to go now to Region 6, which is the central part of Louisiana, Metro Alexandria. And I think, Miss Patricia White, are you with us today? There you are, Ms. White. Ms. White, I have all of your slides that you sent loaded, but if you'd like to control them, I can certainly let you unshare my screen, and you can share yours however you want. Wait, you're on mute. You're on mute. Miss White, you're on mute.
Sorry about that. I
No,
apologize.
no
No, I
problem.
was just saying Reagan covered everything. Basically what I would have, I would just skip to a couple of my slides.
What do you want me to?
Okay, if you'll just go ahead. Basically she talked about the supplies people need to bring, things like that. Some other things that we would recommend is, especially if it's pediatric patients, diapers, formula, wipes, rash cream, those type of things. Some books, games, puzzles, if people have those and they have time to pack those items, those are always helpful in a shelter. It helps to pass the time, helps to decrease the anxiety and things like that. You can go ahead and skip.
Okay.
Another thing that we ask for our older adults is the complete list of their medications. Especially if they're a hospice, home health patient, dialysis patient, if they can bring those folders with them that are given to them by the agency, that is tremendously helpful to us and to the doctors that we have. Another thing too, like if they have any assistive devices such as hearing aids, if they can bring those and along with their chargers, extra batteries, those type of things, a copy of their insurance information, Medicare, Medicaid, private insurance, those things as well. Another thing that we really recommend, we've become a society so used to cell phones, and we keep all of our information stored in cell phones, such as telephone numbers, important contacts, and things like that. Please, please for your clients in the homes, get them to list out the contacts along with their addresses, along with these telephone numbers. Because if the phone goes down, they lose their phones.
Yep.
You would be surprised how many people cannot remember telephone numbers now. And I can remember 2 phone numbers out of my family's information. So I've had to start writing down everything. So, but this is really important because we've encountered over the past shelters, we've had elderly to come in and we've had no way to contact family members. Same thing goes for like their power of attorneys. We need that information, DNRs, living wills, those type of things. Those need to be included in those folders, or if the patient or caregiver can have them in a separate notebook, that is truly helpful. So anything like that. If you want to go ahead and skip to the next one. And we've talked about that, who can assist in an emergency. Like Reagan said, we really like for a caregiver to come with the patient. We are not a drop and stop. We're not a place where you can just drop off the elderly and the families leave and go on vacation in Florida. It needs to be really stressed that if the individual comes to the shelter, they need to have a caregiver with them. But like Reagan said, we will not turn them away if they don't have a caregiver with them. So, we also have a pet shelter next door to us. So if the person comes with pets that are not service animals, they cannot stay in the shelter with us. But if it's a service animal, it provides a function, then we will keep the service animal in the shelter with the individual. But all other pets have to go into the pet shelter. Now, the pet shelter that's next door to us, the clients are allowed to go feed the pets, go spend time with them. It's really encouraged that they do that because that gives them a break, gets them out of the shelter, and also too, it helps out the pet shelter as well because they work on volunteers to come in and feed the pets and things like that. So again, if pets are coming with them, bring the supplies for the pets, vaccination records, food if they can manage it, leashes, those type of things, toys for the pets, whatever. You can go ahead and skip to the
Ms.
next
White, I'm
one.
just curious, how, I know that the shelter that you're talking about is called the mega shelter. When you say mega shelter, how many folks will that shelter actually shelter in emergency?
Well, the shelter is 2 parts. We have what we call a critical transportation needs shelter.
Mhm.
So the best way I can describe it is if you can imagine a Sam's warehouse. Okay, imagine it empty. That's pretty much what our shelter is like.
I
It's
see.
over 220,000 square foot. Now the critical transportation needs side, that's for individuals that have no transportation. So
Right.
they're picked up by parish pickup points, brought on buses, and they stay on that side of the shelter. So that can
Mhm.
hold up to 2,500. On
Wow.
the medical needs side, we can house up to 250. And then we have another section that can house another 250 individuals with the aid of a federal medical station. And that's run by the United States Public Health Service.
Yes, ma'am. Thank you.
Okay. So we talked about pets, pet sheltering. We talked about how the pet shelter is co-located with us. You can go on and skip. You can skip to the next one. Prescription refills. Now, in our shelters, we do have the capability to have prescriptions refilled for individuals. And if you'll go to the next slide, and this is like during an emergency, they can do a state declared emergency, and the prescriptions are able to be refilled at certain pharmacies within our locations, within our region. And so the individual, like if they have a copay, that copay is waived. Now, keep in mind, this is not for all disasters. It's only for, state declared disasters. The governor has declared it. So we do encourage people to bring at least a 2-week supply of medications. we encourage agencies, to tell people to be stocked up on their medications. If they have a few days before it's due for a refill, like say 5 days before, a lot of pharmacies will go ahead and let you refill. Get that refill as soon as you can, and then that way you kind of build up a supply of that medication so you're not completely out in a time of disaster. But we encourage them to bring their medications with them. Now we do have the capability for patients that are on methadone or Suboxone, to go to different clinics to get those medications refilled. But like you stated, for hospice agencies, home health agencies, if we have their patients and they have a sister agency up here, we do require that sister agency to come in and take care of that patient for us, to bring whatever supplies they may need and things like that. Like Reagan said, we have limited supplies and we have the capability to get supplies, and we do have the capabilities to get refills on their medications and things.
I just want to remind people, having said that, even if you don't have a sister agency in that region, now's a good time for you to reach out and to find an agency you can contract so that you can transfer care to that agency so that they could that continuity. The CMS expects a continuity of care regardless of where your patients are relocated to in terms of evacuation. And it's up to the agency to make those arrangements that their patients are being cared for, even in that shelter. So it's
Okay.
not just those that have sister agencies, it's all agencies have that responsibility.
Okay. And if you'll go ahead. And then Reagan talked about what a medical needs shelter is. We're a place of last resort. So, for the agencies, please talk to these family members. If they have somewhere that this individual can go to, they're going to be much more comfortable.
Good.
If you'll go to the next slide. And, go ahead and go to the next slide as well. And to the next one. Next one. Okay, this is what our shelter looks like. Basically we talked about the Sam's warehouse situation. We're just a big open area. These are our beds. They're called Westcots, and we do have the ability to elevate the head of the bed, the foot of the bed. But that's probably about a 2-inch mattress on there. Now, we have been able in our shelter to move in about 39 hospital beds, but those hospital beds are designated for individuals that are quadriplegic, paraplegic, stage 4 decubitus, contractures, tube feedings, things like that. Severe congestive heart failure, severe COPD, individuals that weigh over 400 pounds. We bring in bariatric beds for them as well. But for the vast majority, this is what they're going to be sleeping on. So they're going to be much more comfortable at a family member's home. We do have 3 meals a day, 3 hot meals a day. We have snacks for our patients. We kind of keep the coffee pot going 24 hours a day. But we meet the dietary needs of the medical needs with a low salt, low fat diet. So for a lot of individuals, the food's not always what they're used to, but they are provided meals and snacks and things like that. So we do our best to make them as comfortable as possible. And like Reagan said, during Laura and Delta, we were open for 76 days. Probably about 45 to 50 of those days we were operating a shelter. But also too, we were operating as a transfer center.
Right.
Because individuals were coming to us to get hotel rooms. They may have to spend the night, go on to the next, but we provided medical care services and things like that. During Ida, we were open for about 32 days.
Right.
For medical needs.
So you had patients that were away from home for over 30 days.
Yes.
Yeah. So,
Right.
Shelter living gets old fast, huh?
It does, it
Yeah.
does. But like Reagan said, we start the discharge process upon a time of admission. So as soon as we can get the individuals home, we know that their home is safe, the parish is reopened, then our case management team is working with them to get them back home. And so, if they came by ambulance, then we're gonna get them back home by ambulance. If they came by bus, when the buses start running, we're gonna get them back home by bus. So we do our best to get them home as quickly as possible, but we want to be sure that their home is safe, that their parish is open, that the parish is able to handle their medical needs, because we can't send a dialysis patient home and the parish is not open for dialysis or medical care or anything like that. You're causing more problems for the patient and for the parish itself. So we may look into maybe nursing home placement, skilled nursing placement, something like that to make them more comfortable. So again, we're a shelter of last resort, but we're going to do our best to make them as comfortable as possible. But yeah, shelters are just not always conducive to every patient. So,
Right.
home, family, friends, that's the best thing for them.
And that's why it's really incumbent upon the hospice and the home health agency that has a patient in there to be in contact with you in order to know if that patient is being transferred to some other place. They need to be involved uh, in that decision, or making sure the continuity of care
Mhm.
is being followed. So
Correct.
agencies, you have a legal response, a regulatory responsibility to know what's going on with your patients, even when they're in a shelter. So, again, that's on the agencies to make sure they have that information.
Okay. And so like we talked about and like Reagan, discussed discharge and reentry. We've talked about that. You can go ahead and skip that. If you'll go back, that's our contact information. I have to get off at 2 for another Zoom call, but if anybody has any questions, has any concerns, feel free to contact us here in Region 6. Sometimes people like to come up and look at the shelter, kind of get an idea of that, what the mega shelter is, because it's kind of hard for to conceptualize that. So, Jamie, if that's something that you would like to arrange,
Okay.
for a visit or a tour of the
Yep,
shelter, just
I
let us
would.
know. And we can work something out to where people can come in and see, and we can kind of walk them through the process. So,
Thank you. I think that I appreciate that offer, and let's see how we can make that happen. I have one question for you. We have Mary Tarver as the sort of the hospice home health liaison for Region 6. Is should we be directing hospice and home health questions towards her?
well, Mary is our hospital regional
I see.
designated regional hospice coordinator. Teresa Wall is our nursing home DRC.
Hmm?
I'm not real sure who our home health or hospice DRC is, but Mary will be glad to help you out with any information that she can get for y'all.
Okay.
Um, and
Otherwise, it
Mary,
would go to you.
right, right.
Okay.
During the time of evacuation, we get a lot of calls, to our, the process should be that, again, like you said, they should be registered with their Office of our Homeland Security, Office of Emergency Preparedness within their region, especially if they're going to need transport such as ambulance or paratransits or anything like that. That's the big step right there, because
Right.
we do not arrange transportation, nor does Mary arrange transportation. That is the responsibility of the parish or the home health or the hospice. Now, once that they're registered, then, your at-risk registry, like you send out every Friday, which is wonderful. It keeps us well informed of who's out there, who
Thank you.
has these needs. Um, then GOSEP or OEPs in those regions or in those parishes will make those arrangements for the evacuation process. Now, depending on the region and where they're going to be going to, they may come to us. They can contact us directly through our triage phone lines, which would be listed at the time of the event. Or, they can call us directly at the shelter, because once the shelter is open, we man the telephone lines there. And so then we can answer whatever questions that they may have. And
Thank you.
Mary's on, so.
Yeah,
I see Mary got, you heard your name being used in vain, I guess.
I did. I
Thank,
did. That's
thank you.
okay.
Thanks
I'll
for
let
getting
Patty
on.
do whatever she needs.
Oh,
Thank
no,
you.
no, no. We defer to Mary in all of these situations, Jamie. Mary is the bomb. She takes care of us in this region.
Thank you. Thank you, Mary. Thank you for getting on.
Yeah, sure. I just wanted to say our Region 6 parishes are Wynn Parish, Grant, Rapides, Vernon, Avoyelles, Concordia, Catahoula, and LaSalle. Did I say that? So we're the kind of in the middle part of the state. I am kind of the mirror person to Allison in Region 2 for Region 6. And then I have Amanda Fugler that works with me as well as for our healthcare coalition. And certainly any home health and hospice agencies that would like to come to any of our meetings are welcome. And I'll be glad whenever we have our meetings quarterly. When we have our next one scheduled, I'll send that information to you and you can get it out to your group because everybody is welcome. And we actually, the next meeting I think will be an in-person meeting, and we actually meet at the mega shelter. So if anybody's coming and they would like to attend the meeting, then that would be a great time for y'all to get a chance to walk through the shelter.
Yeah, thank you. Yeah.
All right.
Yeah, you don't have the date of that next meeting, huh? When?
Let's see. I don't think we haven't put it on the calendar yet.
Okay. Well, just send it to me and I'll post it when you send it.
I will.
I appreciate that information and that offer.
Yeah. Mary, do you have anything else to add to what I just said, from the hospital perspective?
We have a great relationship with our hospitals here in our region because we have hospitals spread out throughout our region. To support the shelter, we kind of depend on everybody that we can get in touch with to help. The last time we had the shelter open, we had some nursing home patients, we had some home health and hospice patients. So we've had kind of a little mixture of that. And we usually, whoever we've reached out to a couple of our home health and hospice agencies that were here in our region, and they were able to come out to the shelter and help the staff and help the patients. So it was greatly appreciated. And I'm glad that we have such a good relationship with all of our healthcare partners because it takes everybody.
It does. And again, I want to remind home health and hospices that you have a responsibility to follow your patients, even if they're going into a shelter, and to make arrangements for the continuity of care. Because the folks that are operating the shelter are not skilled in terms of some of the specialties that home health and hospice agencies are skilled in, and they rely upon that expertise to take care of your patients. So you need to make sure that you have contacts with like providers in that area that can help you take care of your patients in the event of an emergency. I'm sorry, Mary, you were going to say.
No, that's what I was going to say, is that because we are a shelter region, a lot of times the clients that are in our shelter, they're not from our region. So we do have to make sure that there's somebody that's tracking them. And like you said, if they're from region 1, 3, 4, 5, and they're in region 6, then we're, looking for resources. And that's when we've reached out to our partners here in region 6, and they've helped us, but it would be ideal to have those facilities that are getting clients moved up to our shelter into, to be followed by their providers, because they have so much information about the patient that really helps with their care.
Mhm.
I did get one question in the chat, and it says, where is the shelter located?
The physical address for the shelter is 8125 Highway 71 South, Alexandria, 71302. And we're right next door to LSUA. So if you're coming down Highway 71 South, you'll see LSUA on the left. You go maybe a fourth of the mile, and we're right next door to them.
And if we're traveling north on what's Interstate 49,
Mm-hmm.
what exit, do you know what exit we would take?
You could take the LeCount exit, I believe,
Count.
and then there's um another exit, but you would have to turn around and get back on 71 South.
Say,
So probably the LeCount exit would be the easiest one to take. LeCount Woodworth exit.
but there's no signage saying mega shelter this way, correct?
No, I mean
The
the only time that
emergency
they could have,
managers know where they are, where it is,
yeah.
but okay.
Yeah,
Okay.
when we're open for operations, then we're lit up like a Christmas
Right.
tree. You know,
Right.
signage is all out there. You'll see just tons of activity around it. But if you were to pass it on a daily basis, you would just say, "Oh, what's that big building out there?"
Okay.
You know,
Well,
so
Dr. White and Ms. Tarver, thank you so much for being on today's call. And I appreciate everything that you're doing in Region 6, because I know it's not just your region that you're concerned about, but as a receiving area for the rest of coastal Louisiana.
mhm.
We appreciate the work that you're doing there. Anyone have any other questions before we sign off? Either unmute yourself or put it in the chat box real quickly. Okay, well, I'm taking all of the slides that you've seen today. I'm putting them into one slide deck, and I will be posting the entire PDF in next Wednesday's calendar invite. I want to remind everyone that this is being recorded. So at the end of today's session, I will be converting that recording and will be posting it along with these other recorded sessions that we had from our previous meeting. We will be meeting next week briefly. It'll be a check-in, but I want to remind everyone when we return on Wednesday, the 31st, we will be looking at the medical need shelters in Mississippi. Again, I want to thank you all for your time today. You can, if you have questions in between now and the next time we meet, you can always reach me by phone, 504-491-6133, or by my email at jboudreau@lmhpco. Until we meet again, be safe out there, and we'll see you next Wednesday. Take care.